Hello, good morning, good afternoon, everyone. You are welcome to this webinar being organized by the African Continental Association for Food Protection. So this is one of the webinar series that we have planned to be having, and this is the first one. We are doing this in collaboration with the Health and Environmental Sciences Institute and the Joint Institute for Food Safety and Applied Nutrition. You are all welcome. So I'll first of all start by giving a brief information about the African Continental Association for Food Protection. So the association, African Continental Association for Food Protection, ACAFP for short, is an affiliate of the International Association for Food Protection. And ACAFP represents members from industry, members from government, international organizations, research and academia, and all food value chain actors interested in protecting the food supply in Africa. So essentially, we represent members from all sectors of the food industry. Next slide, our mission and goal. So our mission is to be the agent for change in Africa with respect to food safety, promoting the production, storage, distribution, and consumption of safe food regionally and internationally. Our goal is to connect food safety professionals and students on the continent of Africa and around the world to serve as an educational and food safety news source for our members. And there are a number of benefits you get when you join this association. One of them is that we all work together to explore various ways to advance food safety in Africa. You learn more about the various new ways of doing things, various methods, challenges, and opportunities. You get to have access to data and statistics on various food safety issues. You have the ability to collaborate with different organizations, different projects across the world. And we have the opportunity to also network with professionals and practitioners. There are so many benefits, and we provide an exclusive access to our growing food safety webinar library, the first of which we have just started. So there are more things coming our way. So to join the association, it is open to everyone who has an interest in food safety. So we have farmers can join the association, students, food industry executives, microbiology, food safety educators, government officials, quality control officials, everybody who has something to do with growing food, storing food, transporting food, processing, preparing any type of food is welcome to join the association. We have a website, which I will share with you in the chat. And how to join, I'll also share a link for you to join as a member. If you also want to join, you can put your email, your phone number in the chat. And if you become a member, you are entitled to pay a membership fee of $25 if you are a professional, $25 per year. If you are a student, you pay a professional fee of, you pay a fee of $10 per year. So on this note, I thank you very much and I welcome you to this webinar. I'll now hand over to Professor Obadina Adewale. I didn't even mention my name. My name is Dr. Rose Omari. I'm based in Ghana. I'm a researcher with the Council for Scientific and Industrial Research, based in Ghana, Accra. So Professor Adewale will now come. He is the chair for Education and Training of the African Continental Association for Food Protection. So he will also come and give us a brief information about the plans they have for us in terms of training and education. Thank you very much for your attention.
Thank you, everyone. Thank you, Rose, for that introduction. As mentioned by Rose, ACAF is for everybody, and what we talk about or what we do in ACAF is all about food safety and how it affects every one of us in Africa. So this is the beginning of the series of webinars that we have put together that we shall be having continuously. At the end of today's webinar, we're going to have another two before the end of this year, 2022. And starting from year 2023, we'll be having trainings for everybody on food safety. Let me apologize that I'm in transit at the airport in Nigeria, so I'm sorry for the background noise and the pictures. Thank you very much, everyone. Enjoy yourself, and I'm very sure that you will not regret joining this webinar. Thank you.
Thank you very much, Professor Abadina, for that introduction. So we are now going to go to our presenters. We have two presentations today. The first one will be delivered by Professor Clare Narrod. Clare Narrod is a professor at the University of Maryland in the USA. She is the director for Risk Analysis Program at the Joint Institute for Food Safety and Applied Nutrition. She is an economist, and she has worked with various organizations, including the FAO and also the International Food Research Institute. So that is IFPRI, International Food Policy Research Institute. So she has a lot of experience and has been involved in risk analysis training all over the world. So we'll now invite Dr. Clare Narrod to give us her presentation.
Thank you. Thank you. I'm really glad to be here. I want to make sure you all can see my screen. Is that correct, Michelle?
Yes, we can see it. I'm just going to add one more thing really quickly. If people have questions during the presentation or after the presentation, everyone is muted because we have a lot of people on. But please put your questions in the question box. That's where we will make sure to see them, and we will answer them as best we can, either verbally, or if we don't get to all of them on the webinar today, we will send out some responses via email. I have everyone's email address.
Great. And so what I'm going to do right now is I'm going to give you a little background about risk analysis and why we do it, and then tell you a little bit about the training programs we offer at JIFSAN. And for those of you who don't know, JIFSAN is one of FDA's training centers in risk analysis that we train people from around the world. So with that in mind, we start thinking about food. Food by its very nature is risky, and there are all different potential hazards in it. You can have food safety hazards associated with BPA, acrylamide, and saccharin. You also can have hazards associated with things like jewelry getting into the food, or different types of glass, or chemicals, or filth. And all these things represent potential food safety hazards to humans. So when we start thinking about risk, we're thinking about risk in terms of being a chance of any sort of undesirable outcome. So it could be a loss in terms of illness, it could be a death, it could be a loss in terms of product, financial setback, or any sort of hazard that may affect food. And it also is a potential gain that's not realized really when a new product did not catch on as it was hoped for, or health did not improve, new trade established, or any sort of opportunity associated with that. So that's what we think about when we think about risk. When we try to put this into equation, when we try to analysis, we really, and this is what's different from things of just having a hazard, we're looking at risk as being something is the probability times the consequence of that. So it's not just having a hazard, you actually have a consequence associated with that. In food safety, we're really talking about that in terms of risks being the exposure times the hazard, and that's what we try to do when we do these types of analysis. So it might be something like number of servings produced in terms of hamburgers times the concentration of the prevalence of the pathogen. And that's how we start going back and make it more scientific of how we're looking at these different hazards and things that we're trying to reduce. And these risks are really serious and things that we need to think about. Up till prior to 2015, there wasn't really a good understanding of the burden of foodborne illness around the world. And WHO at that time came out with the first estimates of that global burden. And that's something that was really important because it's the report that actually put the motivation for policymakers in Congress to recognize the cost of foodborne illness were equivalent to things like malaria and HIV/AIDS. And before that, they didn't really have that motivation to put effort in trying to reduce it. So this was a really important report that came out in 2015, and we've seen quite a lot of efforts now aimed at trying to reduce foodborne illness in countries globally. Basically, what that report said that the burden of foodborne illness was substantial. It was estimated about 600 million people, almost 1 in 10 got sick, fell sick from eating contaminated food, and about 420,000 died. And there was a loss, basically, of 33 million healthy life years in terms of dollars. So this was something that really was something that was motivating governments to take action. Again, children under 5 were more susceptible, and that we found in Africa, almost more than 91 million people were estimated to fall ill and 137 die each year. So this was something that was really important to drive motivation in trying to find ways to reduce the levels of foodborne disease. We know in Africa right now that has one of the highest per capita rates of foodborne illness. It's largely affecting children. Diarrhea disease are responsible 70% of the foodborne illnesses in the region, and non-typhoidal salmonella, which can be caused by contaminated eggs and poultry, causes the most death, killing around 32,000 individuals in the region a year. So these are the reasons why we have that motivation. The economic cost, the burden is really important to get governments to take action. This just shows a World Bank study estimated in Africa that the estimates of the productivity losses alone attributed to unsafe food in Africa was around $20 billion in 2016, and the cost of treating that was around $3.5 billion. So this shows you this is something just really reasons why we need to try to look at ways to reduce the level of illness associated with foodborne illness. Now, we have to look at how this has been done traditionally versus the way it's moving now. And I think one thing that I think it's really important that we recognize that there's been quite an evolution over the years of how we go about trying to reduce risks. Initially, a lot of traditional countries, traditional focus on food safety had been on hygiene, inspection, in-product control, and they may include some food laws, some regulations of food control management, laboratory services, education and communication. But many of these processes were based largely on precedent, trial and error, expert opinion, compromise, the precautionary principle, inspection, zero tolerance, and really ignorance in how we go about trying to reduce these approaches. And many of these approaches weren't very scientific. And so what we see around the world is a push to using more science-based approaches to reducing risk so they can reduce the levels of foodborne illness in countries. And we know that science can help on that. There's been significant progress over the years in terms of refrigeration, pasteurization, pesticide regulations, various food safety laws. We have countries have put in requirements on no color additives to conceal inferiority of foods. And we have manufacturers of new food additives and colors must establish safety regulations satisfaction. So we see a lot of significant progress has made in industry in terms of trying to reduce foodborne illness. But yet we also have changes in food production and consumption. So we have a movement towards more large-scale production units. We have global supply chains. We have that relentless pressure to lower costs, and there's a temptation often for economic adulteration. At the same time, we have a lot of untrained food workers. So this is the reasons why we're looking at ways to use more science-based approaches to reducing food safety risks. And we found that the traditional approaches to protecting the food supply really aren't enough. And we know that science-based approaches can help. And so risk analysis right now is, there's been a movement in many countries in the world to use risk analysis as a way of approaching problems that integrates science with societal welfare values. And we see the global community starting to embrace risk analysis. Now, when we think about this movement towards using risk analysis, we know that risks are everywhere. Some risks are more serious than others, and we have to have a way to weight them. And we know that the concept of zero risk is not an option. There is no such thing as zero risks, and many risks are unavoidable. So we need to have a process to do that and to understand them. And so we do that by starting to describe them, and that's called the risk assessment. We need to be able to talk about it, which is called risk communication. And then we need to do something about it, which is called risk management. And those three elements make up the risk analysis paradigm. And that's important to understand. Some examples of science-based risk analysis activities may be the use of risk assessment to support a country's understanding of how they may alter their food safety regulation. It may also be used to establish a product standards or performance standards or specifications for specific international trade. And it's also used for resolution of trade disputes based on the WTO sanitary and phytosanitary agreement. So there's some examples out there about risk-based analysis activities. Now, I want to bring up a little bit more on the WTO and the SPS agreement, because many countries have become members of the WTO, and this was established in 1995 as an international organization that set the legal and ground rules for international commerce. And basically, the function of the WTO is to administer the trade agreements, provide forum for trade negotiations, handle trade disputes, and monitor national trade policies, and allow for cooperation with international organizations. Under the WTO, there are 3 agreements that really are related to the safety and quality of food that really affect how we do and what we do, the analysis related to risk analysis. There's the agreement on the sanitary and phytosanitary agreement, the technical barriers to trade, and more recently, the trade facilitation agreement. And the first 2 were really aimed at trying to identify how to meet and need implied standards at the same time avoiding any potential protectionism in disguise. And this was really important when, with GATT, the trade barriers started coming down, and there was concern that there might be some disguised barriers associated with people pretending or thinking, or nations thinking there was risks associated with certain products. So this is really why the sanitary and phytosanitary agreement exists. It recognizes that countries have the right to establish appropriate measures to protect their human life, animal life, and plant life and health. But they need to make sure the condition of these SPS measures are non-discriminating and not necessarily trade restrictive between countries with identical and similar conditions, and they have to be based on the science and internationally recognized risk analysis procedure. So this is one of the reasons why we are going and teaching and working on trying to use these risk analysis procedures. Many countries have signed on to the agreement, but many of them have not actually started implementing these risk analysis techniques, and they're very good at aiding countries in deciding how they might choose to best reduce risks. When we talk about risk assessment, it's really stated in these agreements. Article 5.1 requires SPS measures be based on the assessment of risk to human, animal, or plant health. It also says that important countries can rely on assessments made by another country if it's appropriate risk assessment, and they need to consider the techniques of those developed by the sister organizations. So Codex will be for food safety, the Office de Epizootics for animal health, and IPPC for plant health. If a country doesn't have a risk assessment, they can rely on the ones that have already been developed. There are times when they may want to have a more refined one based on their own consumption patterns or their own animal health situation for their own country, which is why it's important for them to know how to do those. Article 5.2 explains what kinds of information shall be considered when undertaking the risk assessment. It's based on the available scientific evidence, the relevant processes and production methods within a country. It may differ by formal and informal value chains. Looking at relevant inspection, sampling, and testing protocols, the prevalence of specific diseases of pests, existence of pest-free areas, and the relevant ecological or environmental conditions and any type of quarantine treatment. These are things that need to be considered also when we're looking at the risk assessments. So again, the risk analysis framework is something that brings in those three paradigms. Risk assessments looking at the scientific inputs, risk management looking at the policy decisions, and risk communication, which is the interactive exchange of information and looking at all the different options when we're concerning risk. So that's just a little overview so you understand. Many of you do already understand, but some of you don't understand why risk analysis is so important. So I want to bring you down to back to looking at some of the things that we do at the Joint Institute for Food Safety and Applied Nutrition. We were created in 1996 as a public-private partnership between the Food and Drug Administration in the United States, the University of Maryland, and the private sector. And our goal was really to advance sound science and improve public health in food and applied nutrition using risk analysis principles through cooperative research, education, and outreach program. And we've been around for a long time, and since 2000, we've trained over 10,000 individuals from over 62 countries, and this map just shows you. So we have a presence in a number of countries. We would like to have more of a presence working in Africa. We hope through this webinar will give you interest in participating in some more of the training programs. Our main training programs have been in good agriculture practices, good aquaculture practices, produce safety rule, train the trainer programs, the grower training programs. We also do training in preventive controls in human foods and foodborne outbreaks. And one of our larger programs is the risk analysis training program, which I'm going to go into more detail because that's the relevance of this webinar. So our risk analysis training program really is trying to put with this increased emphasis on the need to do risk-based decision making and increasing global nature of food supplies have resulted in the use of this. And this largely is being pushed because a number of countries have signed on to the WTO and they need to abide by the requirements of the SPS agreement. So this really created a need for us to develop an education program so that we could train individuals, both in ministries and in academia, on how to do risk analysis. In the US, when we started, a lot of our own agencies and professionals in the agencies weren't trained yet in these risk analysis techniques. So it created a need to learn about the principles of food safety risk assessment, the tools and techniques that can be used to apply to these approaches. And we've been teaching on the risk analysis techniques since 1997. And in the risk analysis program itself, the other map we showed was all of our programs, we've trained over 5,000 individuals from 55 countries. So we do have a presence out there. We have, these are the staff, the various faculty members who teach in our programs. We teach core courses, which would include the overview of risk analysis, overview of risk management, risk communication, and risk assessment. And then we have more advanced training where we have more hands-on. We start training in quantitative risk assessment methods and probabilistic tools. We teach on the FDA IRIS tool, which is a computer interface tool that allows for easier approaches to modeling efforts. We also have courses on food defense, introduction to risk analysis and regulatory process. We have epidemiology courses. We have courses on chemical safety assessments. And we've just added a course on economics of regulatory analysis, which we're going to pilot this fall. I'm just going to tell you a little bit what's covered in these courses. In terms of the introduction to risk analysis and regulations, we talk a little about the language of risk analysis, the risk management decisions, how risk analysis fits into the WTO. and talk a little bit about the general principles of food and public health law so people understand how it's evolved over the years and why risk analysis is being done. And we also talk about how this fits in as an example into the US system, how they actually changed their laws and regulations to accommodate a lot of what's being required under the WTO. I just had a training yesterday with a group of people through the Cochrane Fellowship from Africa. And one of the things that we stressed was that there has been an evolutionary process. In the US, we had to have a lot of new rules put into place that put the requirements for using the risk analysis principles into as part of the regulatory decision making. It's very hard to do that without having that. So that's covered in that program. In the risk management program, we talk about the paradigms of what we think about when we think about risk management. We give a lot of frameworks. We talk about getting the questions right, how we make sense of the numbers that we come out of the analysis, and how we evaluate risk management options and the interactions between the assessors and the risk managers. In the qualitative risk assessment course, we go into the fundamentals and reason for doing risk analysis. We talk about significance of uncertainty and variability. We discuss the areas of probability and quantitative analysis. In terms of risk communication, we talk about understanding the goals of risk communications, recognizing the importance of risk communication, how we communicate expertise and come across as being trustworthy. And we talk about the points of nonverbal communication, et cetera. So these slides, which are going to be shared with you, you can get the details of each of the different courses. In terms of quantitative risk assessment, we really talk about understanding why models are useful. And we talk about how we go about gaining a strong foundation in basic probability theory and probability distributions. We do hand-on trainings using Excel and at-risk. And we teach people how to do stochastic processes and also scenario and sensitivity analysis. Now, on the regulatory economics course, which is a new one that's being added, we're going to train about the different acts in terms of why we're required to do these analyses to inform regulatory decisions. In the US and many countries, such as Canada, the EU, also doing a regulatory impact assessment is part of analysis to support regulatory decisions. So we'll talk about the Administration Procedures Act, what goes into the requirements of regulatory review. We'll talk about market failures and governmental failures and why we do the benefit cost analysis. We'll talk about the costs in terms of the nature of the costs, how we go about calculating that. We'll talk about benefits and net benefits and the impact that is required, looking at the impact on small businesses and looking at international effects and other regulatory requirements of the regulatory impact assessment. And we'll go through a number of examples of food safety regulatory impact assessment. So I'm really excited about that course coming this fall. The reason why we're doing this is that a number of people who are trained in these methods age out of that, and they're no longer doing that, and we constantly need to train people on how to do these analysis. I wanted to talk a little bit about what we do at JIFSAN. Each year we offer a tuition fellowship where the cost of all the training is free. We've given it to 4 people over the years from Africa. In 2012, we had an individual, Limbikani from Malawi. In 2018, we had someone from Namibia. We had in 2021, we had Alawala from Nigeria. In 2022, we had Gloria from Ghana, who received that fellowship, and they got to take all the trainings. The last 2 years, the trainings were done via Zoom, but we are going back next year to in-person training. I also want to talk about some of the training that we've done this year. We do training not only in the United States via Zoom, we also go to other countries. So we have a relationship in Hong Kong. Every year we teach their graduate students on the risk analysis process. We've done a training this year in PAHO, the Pan American Health Organization for individuals in the Caribbean. We've done a training this year in person in Egypt with the Department of Commerce. We had the summer program via Zoom this year. We had people from US, Canada, Italy, Korea, Japan, Bangladesh, and Ghana. We are doing trainings for our food safety inspection and risk management here in the United States. And again, we're piloting this regulatory course in the fall. I want to say that one thing we've recognized, that doing one-off training is not enough. It's better to have mentor programs where we can have sustained mentorship. So we have been working on that with to do capacity building. We've done that in Bangladesh. We've also done that through bringing individuals from Zambia and Ghana through the USDA Borlaug Fellowship. So we've had, in 2016, we had Dr. Maputa from Zambia, we had Rose in 2016 from Ghana, and we had in 2017, Dr. Ernest from Ghana, trained in that extended internship. So that's been a really positive thing, because from there, they actually get to do projects that are country specific and mentored on how to do that and populate it with data in their countries. We also, this is done in collaboration with our extended internship program, which is a three-month program where people come in. And this program has been done with, in collaboration with Institute for Advancement of Food and Nutrition Science and HESI. They come in, they may get a travel tuition, and they participate in our summer program, and then they start doing the project. So over the years, we've trained over 27 individuals in this program. It's been quite successful. The last thing I wanted to talk about is that we also have a database at JIFSAN, which is called foodrisk.org. This is a database, a metadatabase with tools and models for the food safety professionals in industry, academia, and government. And there are a lot of tools out there. These are free and access. And so it's a one-stop shopping area where you can find tools, databases, risk assessment models, and training on risk analysis. And here are just some of the databases out there. There's the point of produce database. There's the food commodity intake database, which is really important for doing exposure analysis. There's a norovirus database. There is the FDA IRIS database, and there's ICRA, which is Interactive Catalog and Risk Assessment Economic Analysis. So with that, that's just a brief overview of why we do risk analysis and what's offered in the JIFSAN training program. That's the last slide I have. Or do I have any questions before we move to Michelle?
So Claire, there's two questions. One, a simple one from Lucia Anilich is, are the courses available online?
We've done them via Zoom the last 2 years. We can look in if there's interest to have them being done online. In the past, we have done them online, but we had more involvement on the introductory courses than the hands-on courses and the longer courses. So we had stopped doing that. But if there's an interest in the African continent for us to do online training, we can start re-look into doing that. I think now the way training is being done has changed in the era of COVID, and we can still look into continue to do that if there's a demand.
Thanks, Claire. Then just one other quick one before we move on to one that's maybe a little bit more detailed. There's a question of whether the courses are offered in other languages, such as French.
Currently, they aren't. We do have individuals that do training in Spanish, but we do not have instructors right now that can do training in French. But we can look and explore if we can find ones to do that, if there's interest.
Yeah, that might be something where some of the people who are on this phone call could help with training.
Right, for the West African countries, yes.
Great. And then I see one more question. Could you expand more on product control and risk analysis as developed by the three organizations? This was earlier on in your slides.
Okay, so I'm not sure exactly if I understand the country, but the question. But in terms of the analysis that's been developed by the three sisters within the WTO, each of them have brought together experts from around the world to do risk assessment on specific topics related to food safety, animal health, and plant health. And so these analyses exist. We can provide you links to them, but they're found on their organization's websites, but we can provide that for you. The benefits of that is if the country doesn't have the people power yet to do these analyses, they can use those to help them look at ways that they can try to reduce risks, or look at baseline risks and then look at ways to manage the risks.
Thanks, Claire. So maybe what we could do for that question is to see if you have additional questions, send an email to Claire.
Yes, thank you.
Okay, and then I think maybe just two other, is that okay? Two other quick questions.
Sure.
One was, are the courses tailored to be country specific?
When we go into a country and teach it in the country, we tailor it to the examples that we do will be country specific examples. If it's done in a mixed class, it would be, well, we try to bring in examples from different parts of the world. So our summer program tends to be people from all over the world, but when we go to a country, the examples we use and the exercises we do would be country specific. And we try to do a lot of hand-on exercises because lecture, just listening to that is not going to teach people how to do the analysis.
Okay. And then there's just two questions, and I think maybe what we can do is send some links afterwards. There's a question about where to find the call for applications for the training and where you can find information on the costs. So sure. I assume, Claire, we can follow up.
We can send you links to that.
Okay, great. Great, and Claire, actually, if in the questions, if you want to go ahead and answer any of those with links, you can access that while I'm talking if you'd like.
I'll look at that.
I think that's all I see, Rose.
Okay. Thank you, Michelle, for posing the questions to Claire. And Claire, thank you very much for this excellent presentation. And we look forward to more collaborations. I believe many more people will contact you. You can also contact Claire through us. We are all working together. So through the association, we can link you up with Claire for further engagement. So our next presenter is Michelle. Michelle has a PhD in toxicology. She has done a lot of work in environmental and health, human health as risk assessment. She previously worked with the EPA of the USA, where she worked on the pesticides program, mainly doing a lot of work in risk assessment. At the Health and Environmental Sciences Institute, where she works, she is now the Deputy Executive Director, and she's in charge of several programs. So we are privileged to have Dr. Michelle Embry to give us a presentation.
Great, thank you, Rose, and thank you to ACAFP for the opportunity to share a little bit about what my organization does and a specific project that I think will be relevant in the food safety context. So a little bit about my organization, which we call HESI, the Health and Environmental Sciences Institute. We're a nonprofit based in Washington, D.C., and we've been operating internationally for over 30 years. Our model is really to bring together different sectors to take science and research to that application and translation. So our mission is improving human and environmental health. We are really operating in a collaborative space where people from academia, from industry, from nonprofits, and from government work together in collaborative committees towards a common goal. And all of our goals are focused again on human and environmental health, safety, and protection. Our mission is to develop science for a safer, more sustainable world. So I know on this webinar today, we were really focusing and talking about applications within the food safety space, but we also have quite a few programs looking at ecological protection, so protection of the environment, as well as things related to pharmaceutical safety and product safety. So we do a lot of different things through our committees, and I'll get to that in one of the next slides. these bullet points here are just some of the a few of the things that we produce. So a lot of what we do is we develop various frameworks for how you might approach a particular problem. We share data across different sectors and organizations and analyze those data collectively. Often we do perform experimental studies, not in-house, we're not a laboratory, but we work with our various partners to develop new tools, new assays, and run some experiments. Most of the work that we do, we put into the peer-reviewed literature, so we publish our work and make it publicly available through open access publications. So the publications that come out of our HESI projects, we make open access. You don't have to have a subscription to the journal. And then a lot of what I'll be talking about today is we participate in many scientific meetings and trainings worldwide, and we try to really make the work that we do accessible. And we also try to take a lot of the things that we hear through our committees and we develop and work to develop training programs. And the website for our organization is hesiglobal.org. I would just encourage you to take a look at that if you'd like to learn more. So we have diverse engagement through various different disciplines and sectors and regions. And I was at the meeting, the ACAFP meeting in Pittsburgh, and met some of you there. And what I heard in a session I was part of is that food safety is a very, very diverse area of practice, and a lot of different people and expertise and needs are within food safety as far as being a food safety professional. We have around 300 organizations that we partnered with and around 1,000 scientists that participate on our projects every year, both public and private sector. We have 70% from the public sector and around 30% from private, and scientists from all over the globe. We also have our resources from various diverse sources. We have grants from different governmental agencies and foundations that operate on an international scale. And our regular operating dues, they support the infrastructure, and many of those come from our corporate sponsors. But most of our work is funded by what we call in-kind support, donated time, expertise, materials, making connections, creating partnerships with other like-minded organizations and groups. So our science focus areas in HESI are listed there. Food safety down here at the bottom is really the focus, but what I've seen in my work is that a lot of the themes and the trends that you see for how you would evaluate chemicals for product safety, as well as medicines and ecological sustainability, they all link in with food safety. So it's a lot of connections between these different topic areas. I won't go into this in detail. These are all our different projects that we have within HESI. So I'm just going to be talking about one of them today. But if you're interested in learning about any of the other programs, look at our website and let me know, and I'd be happy to set up a separate call. And I already kind of covered the different mechanisms of how we do the work that we're doing. So today I'm going to be talking about one of our programs, which is called the Risk Assessment in the 21st Century Project. Before I jump into that, I just wanted to mention a recently formed new HESI initiative, which is really why I've been working with Rose. Rose is on our board of trustees, working with Claire to really scope out some of the needs related to risk assessment training. And this could be food safety, this could be chemical safety, this could be pesticide evaluation. But what we're really interested in is taking the connections that we have and increasing access and availability of foundational risk assessment training focused on the chemical space. That could be food contaminants, it could be pesticide residues like I mentioned, and really focusing on low and middle income and resource limited regions. So the scope of what we're trying to do within HESI is focused in on chemical risk assessment in the broadest sense, which includes food safety. What is the science-based information, methods, and approaches that inform chemical risk assessment, and how can training and capacity building and dissemination be improved? And that's where I think partnering with people like Claire, you just heard about the amazing training programs JIFSAN has, is a really great opportunity. So this really just got kicked off this year. We're creating partnerships to identify the needs and where we can help. So what are the needs within different sectors, countries, and regions? So for you all on this call today, what are some of the needs related to training in the food safety space where there might be an opportunity for us to be involved. Who has the materials and the resources to help, and how can we get started? And we're very keen to involve people from the regions, countries, areas directly in this, so that we would create a program collectively together with people in country who can help us develop something and really identify where we can help and where those resources are needed. So if you're interested in learning more or would like to talk to me a bit more about this, please reach out. Again, we're in the early stages and just beginning to form some partnerships. So I'm going to switch now to talk a little bit about this Risk 21 initiative. So the motivation behind this project, which was really kicked off in 2010, was a shift in risk assessment. And I'm talking about risk assessment very broadly. So there were new regulations, new chemicals, more chemicals, mixtures, a lot of a push to evaluate and look at risk assessment. There's also new methods and new models and new technologies and all this fancy stuff that's out there that is available to us, but we also have much less resources and especially in certain areas of the globe, a push to move away and use less animals for testing. So the result of a lot of work that happened within this project was an adaptable approach that could be used to understand, evaluate, and communicate risk. So it's very simple, but what it does is it distills a lot of the science and a lot of the policies and puts it into something that is easily digestible and packageable for different audiences. So this is what it looks like, and I'll walk through this systematically, but this is a framework that allows you to evaluate your context, whether you're talking about contamination in food or safety of applying a pesticide in a very systematic way. And what this does is it integrates different exposure and hazard or toxicity data streams. So as Claire talked about, risk is a function of both hazard and exposure. Or in toxicology, we like to say the dose makes the poison. So what we're trying to do with the Risk 21 approach is really have it be risk-based at every step. So you consider both exposure and hazard, even at the early stages when you're just doing a quick screen. So the scheme that I'll walk through, it integrates different data types. You might have something very, very simple, or you might have a whole package and 800 pages of data. This approach allows you to look at it from both ends of the spectrum. It also integrates both measurements as well as different models that are available. And a term we like to use a lot is fit for purpose. So you can tailor this depending on the context, the particular case study or the country or the regulation that you're dealing with. And what it allows you to do is look at different models. So animal toxicity data is a model. A quantitative structure activity relationship is a model. So how can those be used for specific questions and problems? And again, it moves from simple to complex. It doesn't make you have to have the most complex data type. It will allow you to look at different sort of mix and match types of information. So quickly, I'm just going to walk through this. So the first step is problem formulation. So really, this is defining the problem and the context. What is the risk of using pesticide X on maize for children? Something like that. Or what is the potential contamination risk from using this chemical to, and what could happen if it could contaminate my water supply? What is the risk? So this is really defining the context. And then that can also be reevaluated throughout the process. The next step is exposure. So you obtain your estimate of exposure, and we have it before assessing toxicity, because oftentimes we end up relying on hazard to start things out. And we're really trying to make sure that exposure is part of the equation at the various early steps. So if you have information on the properties of the chemical you're looking at or the food contaminant, how can you understand what the potential exposure to the human population might be to that and how that could play into your evaluation? And that might be human biomonitoring information, it might be monitoring of a particular chemical in a food product, or it might just be a model based on the chemical properties that you're looking at. The next step is the toxicity estimate. So same with the hazard, obtaining tiered estimates of toxicity using existing information that you have. And again, this allows you to look, I didn't cover this in the exposure, but for both, expressing this as a range. So you might have a single value, you might have a range, you could look at it in both ways. And then the last step, and for many people who've heard about Risk 21, they think of this matrix. It's not the only part, but it might be the most interesting part of it, is this allows you then to take those estimates of exposure and hazard, intersect them on this matrix to allow you to visualize risk and also understand where there may be data needs. And I'll go through that matrix in a minute. And then as you evaluate, then you can either cycle back through and say, I need to refine the information that I have, or conclude your assessment. So the principles are here. I think I've covered most of it. I think what's most exciting for many is that it's transparent and visual and allows easy communication of risk. So I already covered some of this. The problem formulation is the start. What is your objective? What is your scope? All of this, we have a pretty picture we can make on that red and green and yellow matrix. If you don't identify the problem and really lay out what your particular issue that you're addressing is, then those pictures don't really mean much. So what do you know? What do you need to know? And how do you know when you're done? And one thing that we've sort of been using is, do you have enough precision to make a decision? So depending on whether you're doing a prioritization of 100 different chemistries or you're doing a very definitive cancer risk assessment, the amount of certainty you need or the amount of precision you need to make that decision might change. You might be able to make a decision with data that has quite a bit of variability if you're just doing a quick prioritization effort. So something to keep in mind. This I think I already covered, so I'm going to go through really quickly, but I will provide the slides so you can go into it a bit more. This just expands that inverted triangle. But what I wanted to just cover is that we organized it like this with tiers of information going up, where as you move up and the triangle gets wider, you have increasing resources and refinement. This is particularly important because in many cases, we don't have resources to collect detailed monitoring information. So what we tried to do is organize this such that if you had very minimal information, you could still use a risk-based approach. And the same goes for toxicity as well. There are strategies that can be used or data that can be leveraged from other organizations that can help inform toxicity without having to spend a lot of money to run a whole bunch of additional studies. So the matrix, I want to spend a little time on this. This is that visualization part of Risk 21. When you have your information on toxicity and exposure, it's organized where you have your exposure estimate on your x-axis, your toxicity estimate on your y-axis, and the units have to be the same. So if your exposure is in milligrams per kilogram body weight per day, in toxicity value, that has to be the same for exposure. The units on the toxicity axis are backwards because the higher the number, the lower the toxicity. And the shading is basically just a visual guide where the yellow line is essentially your margin of exposure, the ratio of exposure divided by hazard. And right now where this yellow line is set, it's at a 1-to-1. The user can modify where this yellow line is, which changes the green and red shading depending on the context. So what you have here is you would have your range of toxicity values, your range of exposure values, and the intersection of those is plotted on this matrix, and that gives you a visual representation of risk. And that's really the culmination of the information in a single picture there. So there's many uses, and I don't have time to go through all of them. There's a web-based tool that will create these plots for you. It's at risk21.org, and I'll show that website later on as well. This is just an example. You might have multiple examples or chemistries that you're evaluating. These boxes allow you to also understand data needs. So example D, we have a pretty tight range of toxicity values. Collecting more toxicity data is not going to be that useful. But we have a big range in our exposure estimates, and this could be because we collected monitoring data from thousands of products. What you might want to do with this example is go and see what are the products that had really high levels? Those are the ones where you have the highest risk. And maybe there's other products that are down here where the exposure is very low, and you could refine this a bit more. Example B, we have a pretty good handle on the exposure, but the toxicity estimates are a pretty wide range. So that might be something where you might want to look at the different endpoints or the spread in the data or the study quality and get a better understanding of what's going on there. For example E, it's in the red, and refining the toxicity data or even going and doing more sampling is not going to change your risk picture. This is an example where if you saw something like this, you would have to evaluate mitigation options. Can you, if you're looking at an industrial plant, can you have people wear protective equipment, gloves, masks, etc.? Is there some treatment of the food that would help reduce the exposure? So that's just a couple examples of how it might look. And there's many different ways you can use the matrix. If anyone would like to learn a little bit more, have a hands-on kind of quick tutorial, I'd be happy to do that. There's many different ways you could look at it. You can look at ranges, you can look at scatter plots, point values, and this would allow you, for example, to do a prioritization exercise. The other is you might look at a single chemical with different exposure scenarios. So this is actually one where we have indoor exposure is high, outdoor exposure in an urban area is in the middle, and if you live in a rural area, it's very low. So your risk is very different, even though it's the same chemical. And you can plot all of these things in one fell swoop on a single plot. So the last piece I'm going to talk a little bit about is some examples of this, but I did want to mention we've had many outreach workshops all over the world. We have a couple coming up this fall. We have a collaborator who's done these trainings virtually in Spanish, and she's doing some in Argentina and Panama and Colombia this fall. I will be part of a course in Thailand in December, and these hands-on in-person courses are very interactive, where we have developed case examples of how this could be used and applied in-country, relevant examples, and then everyone gets on their computers and tries these out, and it's been a really rewarding experience. Been talking with Rose for a long time about trying to do some of these potentially in collaboration with her in Africa. And all of our papers that are part of this are on that website, risk21.org, and are open access. And this really goes into a lot more detail than I have time for today. So I'm going to really quickly fly through just a couple examples for food safety. I met Rose when she was actually doing a fellowship program with Clare, and she did her project on aflatoxin in maize groundnut complementary foods, such as Weanamix. And her problem formulation was evaluating what is the risk of developing liver cancer from exposure to aflatoxin in infants aged 6 to 12 months in Ghana if they consume both or either homemade or commercially prepared Weanamix. So she had exposure estimates from Weanamix samples collected from shops in Accra that were analyzed for aflatoxins, and they also were able to use another publication that measured aflatoxin in a type of product that was prepared within rural households. Toxicity estimates, aflatoxin's been very well studied, so the reference values were from the European Food Safety Authority were used for this, and then she used the Risk 21 matrix to plot it and look at the risk, and this has been published, and the link is down below. And this was just an example plot that Rose and her colleague developed, showing that the aflatoxins found in, the concentrations varied, which you can see here with the exposure on the x-axis is quite wide. There were higher concentrations when it was prepared rurally rather than the commercial preparations in urban shops. But it does highlight the fact that training and management, there's a need for that. And there's more work that needs to be done to understand best practices for processing to reduce the concentrations and then the overall risk. I'm not going to go through these in detail. There have been a few other food safety examples published. This one is by a collaborative group in Taiwan looking at human health risk from DDT, which is a pesticide that's been banned in many countries, but also is used specifically for malaria control. and there have been residues found in some of the rose flower tea that Taiwan has imported, and they were really interested in looking at risk to different populations from both drinking tea as well as direct consumption of the petals. So these plots were in their publication, and it's linked there. And it's in Chinese, but if anyone would like an English translation, we have that available. There's also a recent publication that was looking at chemicals present in food packaging and potential risk from migration from the ink. And this was one where they looked at different margins of exposure for several different age groups, and they did a scatter plot to try to get a handle on which age groups would be most potentially at risk. And that publication's linked there as well. And then the last one I just wanted to highlight is a example that we developed for Colombia to look at how you might prioritize insecticides. So they were interested in looking at insecticides used on potatoes in Colombia, and we developed this specifically for the region. Insecticides used on potatoes, and they're interested in potential contamination of drinking water. All of these pesticides are very well studied with lots of toxicology data and environmental fate information, so the chemical properties that would help determine how a pesticide, if it's applied to a field, could get into the water. We also used Colombia-specific water exposure models to obtain exposure estimates. And what I just wanted to quickly share is, at first glance, and all the details aren't important here, we have 4 pesticides. And if you just look at the second column and you wanted to prioritize which one do I think is best to worst for water, for potential need to regulate or evaluate or get more information, you probably, if you just ranked them based on toxicity information alone, hazard information, this top one has the lowest value, so it would be the number 1, probably the worst case. Then you would move to the second one, this one down here, and then third, this pesticide CY. So this is the order you might rank them in if you were prioritizing. What we did is we got exposure information and then used a risk-based ranking using our risk 21 plot. Pesticide CH is still number 1. It's up here at the top. It has higher toxicity value. But this one, pesticide TM, that was ranked 3rd, is now pretty far over to the right. We ranked it number 2 on this plot because it has much higher exposure. And this was largely because it's very water soluble. Then we had pesticide CY as the 3rd one, whereas before we had that as the 4th one, because again, the exposure value is a little bit higher. And then this one that we had previously ranked as the number 2 actually is our lowest, because again, of the ability for this chemical to get into the water, it was very, very low. So it was a really great example to show how using a risk-based ranking and integrating exposure can really change how you might prioritize. So I know it was a lot of information to go through, but I just would like to thank you all for the opportunity to give this and for connecting in today. I do have 2 requests. One is that if you have ideas or examples of how you might use this approach, even if you're not really sure how it would fit, please contact me, because I would love to collaborate. It would be great to try out new examples that are relevant to the work that you do, to issues that you might be facing within your own countries. Try it out and see how it goes. Claire, through the program at JIFSAN, I've been giving similar presentations to the fellows that come in, and many of them use this to help just organize the information and help communicate some of the work that they're doing. So we've had a lot of success there. Please visit the website. So that matrix has a web-based tool that allows you to create those plots, has the open access publications and a user guide. A lot more information is available there. And please feel free to reach out to me. I really look forward to this being the first webinar and the beginning of some fruitful collaborations. So thank you very much.
Thank you very much, Michelle, for this wonderful presentation. You've given us a lot of information, and I believe people will really want to follow up to get more. So can you see some questions?
I can, yeah, and I'm happy to take those. Let me just stop my sharing here. Okay, great. So there's one question, is it possible to do such estimation with microbial pathogens? I think it is. That's something that I would love to explore, and Claire and I have talked about it a little bit. I don't know that I have done any on microbial pathogens, but I would really love to try it out. There have been quite a few people that have asked about that particular application, so would love to explore that a bit more. Okay, and then there's another question. Do you mean we can leverage existing toxicology data to establish risks associated with food products? For example, if there is a lot of pesticide data on maize, can I leverage that rather than analyze maize samples for pesticides? So it depends, of course, but there's many, the way many countries do their assessments is you might have monitoring data, but you also might have models that will provide conservative assumptions of, if I know how much pesticide is sprayed on maize and how often it is sprayed on and what the properties of that chemical are, you might be able to get a conservative, meaning a high-end estimate of what the concentration could be on maize. Now, that is going to be potentially different than what you would actually detect in maize if you're looking at concentrations for dietary exposure. But there are models that can be used to get ideas of exposure to, especially with pesticides. Now, for toxicology, a lot of, depending on the pesticide, and my guess is, most of these have been registered in various areas of the world, so there's likely existing risk assessments out there, or there's existing toxicology data that are available that could be used and leveraged at least as a starting point. So you might be able to use an exposure model to get an estimate of concentrations in maize, and you might be able to use existing toxicology information from some other published assessments to give you an idea of where it might be most useful to do monitoring or analyze samples for pesticides. Now, Claire might be able to speak to this a bit more. Of course, for import-export and various types of other regulatory pieces, the measurement might be required. So that's a different question. So it's all dependent about the particular context. Hopefully that helps. I don't know, Claire or Rose, if you have anything else to add on that. Okay. There's another question. Are we collaborating with a nonprofit called Partners in Food Solutions? Not yet, but I'm not aware of them, but I would love to learn more about them. So I will look them up. And if you have any links or information about them, I encourage you to please send that to me. I see one more question here. Yeah, a question from Isaac, and thank you for the link to Partners in Food Solutions. Yeah, the question is, a lot of smallholder farmers use agrochemicals with very little information on applications. Are there any models that can help about this? The regulations in Africa are a big challenge, and most on the foods with pesticide residuals do reach the tables. So there's a lot in here in that question. There's been an effort, and I've been trying to work on getting a collaborative group to create a strategy to better share pesticide label information. So again, and this is very dependent on kind of the formal versus informal economy. For pesticides that are registered, they're in many countries, most countries, but not all countries, there's a label that tells you, in this area, this is how much you should apply to maize or potatoes or legumes, whatever that is. And that's based on information on how well the pesticide works, what pest it works against, and also what is acceptable from a risk-based side of things. Those labels are often hundreds of pages long and not very easy to decipher. So there are some efforts to try to figure out, can we make those more easily accessible and searchable, first of all, through an electronic type of database. But a lot of the people I've been working with are thinking a little bit about how you could simplify them so you can communicate to the small farmers more detailed information on application. A lot of that is kind of community extension and outreach, and I know there's various groups that have been doing that, but it's a constant challenge, and I think figuring out better ways to make the information on how they should be used and applied in a safe way is one of the big challenges. And we can share the presentations later. They will also be, there was a question about this earlier, they will also be recorded, or this was also recorded and will be posted on the ACAFP website. So we'll send that around to everyone. And from the risk software, it's a web-based tool, and it's you don't have to download it, it's just on the web, and I will send the link. But I would be happy to I think I just sent it to the wrong one. But I'd be happy to do any follow-up or demonstrations if people would like to learn more about how to use it. There it is, it did show up. I don't see any more questions, Rose.
All right. Thank you very much, Michelle, and thanks to everyone who has participated in this webinar. We have with us the president of the African Continental Association for Food Protection, Professor Joseph Odumeru, to give us a closing remarks.
Thank you very much, Dr. Rose Omari. As indicated, I'm the president of the African Continental Association of Food Protection. And indeed, it is a pleasure for me to provide the closing remarks for an excellent webinar on risk assessment approaches for food safety, presented by Dr. Clare Narrod, Director of Risk Analysis, Impact Evaluation Programs at the Joint Institute for Food Safety and Applied Nutrition, and also a presentation from Dr. Michelle Embry, Deputy Director, Health and Environmental Sciences Institute. The webinar covered the risk analysis process that is required by many countries for protecting food safety supply. It covered various aspects of risk assessment, risk analysis, and risk management, and provided a very comprehensive information on the Health Environmental Science Institute. At the beginning of this webinar, Dr. Clare Narrod began her presentation by providing the definition of risks, risk assessment, risk analysis, and risk management, and the burden of foodborne diseases, cost of food illness in Africa, and science-based approaches to reduce incidence of foodborne illness. She also spoke about training programs available at JIFSAN, Joint Institute for Food Safety and Applied Nutrition. So if you are interested in risk analysis training, please contact Dr. Clare Narrod, or you can also contact Dr. Rose Omari from our association, and she will put you through to Dr. Narrod. Also, during this webinar, Dr. Michelle Embry gave a presentation on Health and Environmental Science Institute and the risk assessment in the 21st century, Risk 21 framework. And I thoroughly enjoyed both presentations. Michelle shared information about the Institute, including the mission of the Institute and the various training programs that are offered by the Institute. So if you require additional information, as Michelle indicated, please contact her and she'll be quite happy to provide additional information to you. So with that, thank you very much, Dr. Narrod and Dr. Embry, for excellent presentation. So I'd like to highlight that this is the first webinar African Continental Association of Food Protection is hosting. We've had a number of webinars that is on our website, which you can access, but this is actually the first one, and we're hoping to host similar webinars in the future. As Dr. Adewale Obadino, who is the chair of our education and training programs in Archive, he indicated that this is the first webinar, this is the first of series of webinars to come. So stay tuned and we'll have additional information to you on upcoming webinars. And also during the opening remarks that Dr. Omari presented, she gave an overview of the association, the mission, the vision, and the benefits of being a member. She provided a link to our website. So please take the opportunity today to access the website and become a member. And we really look forward to having more members, because all of us are very interested in on food safety, not only in the continent of Africa, but worldwide. So it's of great benefit to be a member. So with that, on behalf of the association, I'd like to thank the presenter, Dr. Clare Narrod and Dr. Michelle Embry, for excellent webinar. I thoroughly enjoyed this. I've been in my career, been in food safety for over 30 years, and I'm always learning and learning. And you guys gave an excellent job, talking about the tools, food safety tools on risk assessment, risk analysis, and risk management. Of course, you presented the various training programs that are available. So again, I encourage everyone, especially those that are interested in knowing more about risk analysis programs, to be part of that and contact both presenters. So we hope to have a similar food safety topic in the future, as I mentioned, and we look forward to that. So with that, I'd like to thank all of you that are registered to attend this webinar. I certainly hope you enjoy listening just as much as I did. I really enjoyed this webinar. And there are a lot of valuable information from this webinar. So as Michelle said, it's going to be provided to you. You're going to have it's recorded, and you have the opportunity to, if you miss anything, to go back to it. So with that, I wish everyone a good morning. Of course, it's morning here where I am. It's afternoon in some of for some of you, or even evening, depending on which time zone you are in. So that's the beauty of having this type of webinar for the continent of Africa, because we can always make time for it. So with that, please remember to be part of the association if you are not already a member. Again, thanks to all our presenters, thanks to all the audience, and we wish you a great weekend, I should say. It's already Friday, so so have a good weekend, everybody, and thank you for joining this webinar. Excellent webinar. Again, thanks Michelle, thanks for Nara for giving this, Claire, I should say, sorry, Claire and Michelle, for giving an excellent webinar. Thank you very much. So with that, I pass it on back to Rose. Thank you.
All right, thank you very much, Prof. Yeah, so we are welcome to, or we are open to receive your topics. If you want a webinar on any topic, feel free to send your topics to us, and then we'll organize the experts to come and provide the information. So thank you all very much, the presenters and all the audience. Have a nice weekend.
Thank you.
Bye-bye.
Bye.